Hey everybody. So this is a video about retainers and retention. So there's two basic kinds of retainers we're going to talk about today, both removable. One is the clear retainer, which we call the vivid retainers. And the other one is the Holey style, which we typically use for younger kids who needed what we call early treatment or phase one treatment. So let's talk about the clear retainers first, our vivid retainers. So as you can see here, they are molded to the teeth, and we typically make these while the braces are still on. We take a digital scan of the patient's teeth prior to the braces being removed, the visit before, and our lab will digitally remove the braces on the computer screen from the teeth. And they use 3D printing technology to actually print out your teeth without braces on them. And then they make this clear plastic retainer, which is custom formed to your teeth. Now, our standard retention, okay, you actually get a set of two of these. We typically make these for the top, and you have two identical sets. And the lifespan of one of these is typically about 1.5 years on average, a little more, a little less, depending on how well you take care of them, on if you grind or clench your teeth or not. But we make sure you have two of them to start. That usually will last you, if you average it out, about 3 years or so. Retention is a lifetime thing, all right? So you will need to replace them at some point. We do give patients the opportunities to get 4 of them when they get the braces off for a discounted fee if they like. But the standard is 2 retainers. If you lose 1, 2, you have a backup. Okay. So these retainers, we do ask you to wear on your teeth 24 hours a day for the first 2 weeks you get off your braces off. So they are only taken out for eating and for brushing. Okay. You never put them anywhere but the case and in your mouth. Okay. Very easy to throw these away if you wrap them up in a napkin. Okay. So case or mouth is really the only 2 places they should go. All right. So you can see they fit on really snug. Sometimes they're a little tight the first few days. They will loosen up. But like I said, they're custom molded to your teeth. Now, as far as maintenance on these, okay, you do want to brush these every day. However, you don't want to use toothpaste. The toothpaste won't break the retainer, but the abrasive in the toothpaste will scratch up the clear plastic. It'll get rough. It'll get cloudy, all right, because it'll start to attract a lot of plaque and bacteria, and then it gets harder to clean it. So we do ask you to use a separate toothbrush, okay, and soap and water, soft soap that you have typically in your bathroom, and you're going to scrub these inside and out, all right, to keep them clean and rinse with cool water. Never in really hot water, okay? It can distort the material, okay? So brush it twice a day whenever you brush your teeth, but with soap and water, and obviously a separate toothbrush unless you like blowing bubbles with your toothbrush after you put it in your mouth, okay? After the first 2 weeks, we will then ask you to wear it after dinner till the next morning, usually for about 6 months. After you've had your braces off for 6 months and you've worn this well, then you will wear it. We'll ask you to wear it only to sleep, okay? Retention is a lifetime thing. Your teeth are never guaranteed to stay exactly where we put them. But if you wear a retainer every night, they will stay looking really good and your bite will stay in the proper position. If you stop wearing your retainers, there's a good chance your teeth will shift over time, okay? So those are our vivid retainers, okay? So let's move on to those are instructions that'll come with all your retainers too, which are in the boxes that you'll get. Okay. Now let's talk about the Holey retainer. Now this is more of a traditional kind that most people, when they think about retainers, they'll think of. Okay. And like I said, we typically use these for phase 1 or early treatment patients, the ones who need palate expanders when they're 7, 8, 9 years old. And it's made of acrylic and metal wires that kind of clip around the teeth and hold the teeth in the proper position. These can be custom designed, obviously, which whatever patterns or colors kids like. So it's another reason that we use them for younger children. We can adjust these more as teeth come in. We can trim the plastic, the acrylic, but also most kids like these better because they're more fun to design. These are much more durable too. If you take care of it, this will last you as long as you'll need it. Okay. So typically our instructions are to wear this for about 2 months all the time. After that, obviously, you take it out to eat and brush as well. All right, same instructions. These you can brush with toothpaste, though. These are not going to scratch up as easy. So you can definitely just finish brushing your tooth with the toothpaste, and you can go right on the retainer, both sides, keep it nice and clean, and then rinse it off. Okay. After the 2 months of wearing this all the time, we will then ask you to wear it just at nighttime, after dinner, till the next morning, until we tell you otherwise. And this will keep whether we did expansion, whether we lined up the front teeth, anything we've done in phase 1, this will maintain your result until you're ready for your comprehensive or full set of braces later on. Okay, so I hope that answers most of your questions about retainers and the instructions we give and the maintenance on them, and look for our next video.